Yeah, hello. Once more, welcome to my channel again. This is Dr. WAN. I'm going to talk about diabetes in relation to cooking and cookery. Now, the first question is, what is the difference between cookery and cooking? They are two different things, so don't get mixed up here. The fact that you can put a pot on a fire and throw in water, put salt and oil means you know how to cook. It's a big fat lie. There is a particular way to prepare meal for patients with diabetes and obesity. So stop deceiving yourself by going around the place and eat all the gunks. It makes your situation worse. So I will strongly recommend each and every one of you watching me, if you are suffering from diabetes, obesity, excess weight, listen carefully. Every food or meal or component of a meal has a temperature which that food nutrient has to be prepared. For instance, you cannot put potato and carrots in the same pot and boil it at the same temperature. You are doing the wrong thing. Neither can you put carrots and groundnut or peanuts in the same pot and boil at the same time. No way. You cannot take vegetable and prepare them alongside with meat. No way. So that's what I'm saying. So we already know in the previous video that patients suffering from diabetes, have to be more precise, uncontrolled sugar value. Some even have what we call roller coaster symptoms. So such patients, they need to be very careful with the diet, the type of food that they eat, and also the temperature in which it's being prepared. Carrots, for instance, is eaten raw. You don't have to cook carrots for diabetic patients. Point number one. Point number two, vegetable, if possible, I will say eat them raw. Why do I insist on this issue of eating vegetable raw? Vegetable, they all have enzymes and other mineral content in there that helps to metabolize your food, to facilitate food metabolism and absorption. So it can be kind of funny for you to put vegetable in a pressure pot. You can't put vegetable in a pressure pot. They don't do that. So that's what I'm here to say. So you are cooking, you are not doing cookery. So cookery is a lesson by itself, and it's also a profession that you have to learn it. So once you are being diagnosed of diabetes, the next step will be to also understand how to prepare your meal. You don't just eat any sort of food. You will find yourself in trouble. You risk ending up down the rabbit hole, as I always say. So taking a course in cookery will help a long way in bringing back your blood sugar value to normal. Our main target here is to make that blood sugar value to plummet, not to spike. So don't go around eating food left and right when it is not well prepared. And that's why I always refer each and everyone with diabetes, obesity, and excess weight to see a dietitian. A dietitian is not a nutritionist. Nutritionist, let me give you now the difference between a dietitian and a nutritionist. When you are a footballer, you don't really need to see a dietitian. You can see a nutritionist. But when you are having a medical condition, you don't need to go to a nutritionist. You go to a dietitian. So that's the main difference. There's no point me saying further, but I'm just giving you an example. Those who are involved in marathon, they go and see nutritionists because they need the macromolecules or the minerals and everything there in order for them to meet up with the speed. But in this case, you are already having a pathological situation. You don't need to go there because they don't do the molecular calculation, or call them the milligrams of various mineral or micromineral. They don't do those ones. It's not part of their job. So the best person would be a dietitian. Dietitian, they study all those things. They make sure that they place you on a particular diet. They do some weighing on a regular basis as you go there for your appointment. So time and again, you keep visiting this expert in and out in their studios, and they keep monitoring your situation. I will give you another good example. Let's assume that Mr. XYZ loves eating potato. Now, that potato has a higher value of starch. So we need to also see now how much quantity of starch he or she needs. Whereas for a soccer player, we don't care about those things. We just want the soccer player to score a magic goal. So more energy is needed. After all, it's just 90 minutes. It's done. But for you with medical condition, we have to do a follow-up all through your therapeutic program. It could be 3 months, it could be 6, 9 months, or 1 year, based on how you adapt to the situation. We always come to kind of a common ground or a compromise between I and the patient. And I ask you, how flexible are you? Your availability, then decide now to design for you a personalized diet plan. When I say personalized diet plan, I mean by saying that if you are living in Canada or North America, what we have as food is not the same thing we have in Cameroon. So I cannot be telling you about Aero, which is not a North American product. But I will tell you, get Aero if you are in Cameroon or in Africa, tropical countries where those things are available. Just like I cannot be telling you in Cameroon, say hot dog. That's crazy, because that diet plan doesn't suit a Cameroonian living in Africa. So that's the meaning here. So make sure you work with the right person. I don't want to advertise myself, no, but feel free to come back to me and I'll provide for you a diet plan and everything that is needed. So back again, take home message. Every food component has a temperature, and the enzymes also, their behavior. Remember, enzymes are biocatalysts. So being biocatalysts, meaning that they are sensitive to temperature. So if you choose to put your carrot in the pot and boil it, you are not doing anything here. You are not doing the right thing. You are doing the wrong thing. You are simply increasing the volume of the stool. That's what you are doing. That is, you are making that carrot to become more of a stool softener. Whereas if you eat that carrot raw, it does many things in you, because some component of it gets to the blood, it has the vitamin C that gets absorbed, and also other things. So that's what I'm saying. So watch out when it comes to food if you are a patient with diabetes, obese, and other stuff, as well as cardiovascular diseases. So that's the information for you. Feel free to come back to me if you have any questions. Don't forget to subscribe to my channel, like it, follow me on Facebook, ask any question, and I will answer you. I love you all. Have a wonderful evening. Ciao.